Hello class, good morning. So welcome to the second topic for our midterm, which is the circulatory system. So the circulatory system is made up of blood vessels, blood and heart. So usually the arteries carries blood away from the heart and the veins carry blood back to the heart. So the circulatory system carries oxygen, nutrients and hormones to the cells and tissues and removes waste products and also carbon dioxide in the body. So carbon dioxide will be delivered to the lungs and will be exhaled outside the body through the process of your exhalation, while toxic waste will be delivered into the kidneys and eliminated through the process of urination. So now let's go to the objectives of this lesson. So first, describe the characteristics of different blood types or different types of blood cells. So in this part, so you will identify what are the different blood constituents and what are their distinguishing characteristics. Next is describe the major difference between the walls of your arteries and of that vein. Next is differentiate between serum and plasma. So later on, you will know what are the differences between your serum and your plasma because I know that all of you are confused between the two terms. So in the later part of the video, so I will discuss what are the similarities and the differences between your serum and plasma. Next is name the parts of the heart and describe their function. Next is to locate the veins in the arm and explain how each would be used in venipuncture. So remember that uh, most venipuncture procedures are done in the arm of the patient or arm of the person rather. So you will know later on what are these three major veins and arms that are usually preferred when it comes to venipuncture. Next is to explain the systolic and diastolic pressure or your blood pressure. So class, please remember the key terms involved in our lecture. First one is the antecubital fossa. So as a brief overview, the antecubital fossa is a region in your arm that where the three major veins for venipuncture is located. So here it is the most preferred site for your extraction or your blood extraction. Next is the anticoagulant. Please remember that. And also the basilic vein. So basilic vein is one of the major veins located in your antecubital fossa. Next is the buffy coat. So you will know later on what is this buffy coat and which is it is located when we separate our constituents. Next is centrifuge. When you say centrifuge, it is a machine that separates the blood constituents. So it is used to furtherly display the division of each blood constituent. So you can see different layers uh, of your blood. Next is the cephalic vein. So cephalic vein is also one of the major veins located in your antecubital fossa. So as you can see, dalawa pa lang na-mention natin. This is your basilic and your cephalic. So actually, tatlo sila. So you will know later on which is the other one. Next is diastolic. So when you say diastolic, the blood pressure when the heart is at rest. Next is endocarditis. From the term itself, endocarditis, it is the infection of the inner membrane of the heart. So next one is your erythrocytes. So when you say erythrocytes, these are classified as red blood cells. So the other term for your erythrocytes is your red blood cells. Next is hematopoiesis. So hematopoiesis is known as the formation or the production of your blood cells. So next one is your leukocytes. From the term itself, leukocytes, it is the other term for your white blood cells. So kanina, si erythrocytes, that is your red blood cells. Si leukocytes naman, that is your white blood cells. Next is the median cubital vein. So this is the um, third vein located in your antecubital fossa and the most preferred vein when it comes to blood extraction. So you will know later on bakit siya naging best vein for your extraction. Next is occluded. So when you say occluded, class, it is blocked. So the normal flow of the blood is prevented. Next is plasma. From the term itself, plasma, it is a blood fluid that contains blood clotting agents. So as you can see, this is seen in your anticoagulated blood. So kung anticoagulated blood siya, makikitang fluid dyan na color dilaw, that is your plasma because it contains your blood clotting agents. Meanwhile, your serum is a fluid from blood without clotting factors. So this is seen in your coagulated blood. So kung wala siyang anticoagulant, that is called your serum. Pero kapag may anticoagulant siya, that is called your plasma. Next, the involvement of your pulmonary system and your systemic system, which is essential for your uh, circulatory system. Next is your systolic. From the term itself, systolic, this is the blood pressure when the heart is fully contracted. So, kapag fully contracted siya, it is systolic, pero kapag at rest, that is your diastolic. Lastly is the thrombocyte. So, the other term for your thrombocytes is platelets. So, i-recall natin yung three sites. The first one, erythrocytes, that is your red blood cells. The second one is leukocytes, that is your white blood cells. And thrombocytes, that is your platelets. So, please remember these important key terms, especially these are essential for your circulatory system. So let's go to our topic proper, which is the circulatory system. So as by definition, the circulatory system is a transportation system for the body to transfer substances and waste from one system to another. So actually, our circulatory system is composed of two parts. The first one is your pulmonary system, which circulates blood through the lungs, where the blood is enriched with oxygen and waste carbon dioxide is removed. So the pulmonary system, on the other hand, is the network of organs and tissues that helps you to breathe. So it includes your airways, lungs, and your blood vessels. So the muscles that powers your lungs are also part of your pulmonary system. So these parts work together to move oxygen throughout the body and clean out waste gases like carbon dioxide. It is due to the process of your exhalation. Next one is your systemic or the systemic system. So the systemic system provides the functional blood supply to all body tissues. So it carries oxygen and nutrients to the cells and picks up the carbon dioxide and waste products. So it supplies also the cells with oxygen, fats, carbohydrates, and other energy sources while at the same time removing your waste products. So also in addition that systemic circulation carries the oxygenated blood from the left ventricle of the heart through the arteries to the capillaries of the tissues in the body. So actually, phlebotomists must be knowledgeable with this system since most of its work is related with blood. So let's go to the anatomy and physiology of your circulatory system. So at first, you see here is the bone marrow. So the bone marrow is the primary organ for blood cell production or your hemo or your hematopoiesis. So within the bone marrow, all blood cells originate from a single type of unspecialized cells called a stem cell. So when a stem cell divides, it first becomes an immature red blood cell, white blood cell, and platelet producing cells. So the immature cell then divides matures further, and ultimately becomes a mature red blood cell, white blood cell, and platelet. Then you have your blood, which is the function is to carry oxygen and nutrients to the body tissues and to remove the waste products, carbon dioxide, and toxic metabolites. And also, they carries nutrients to all parts of the body and moves the products to the lungs, kidney, liver, and skin. So the normal adult volume or adult blood volume, that is your 5 liters. So approximately 68 kilograms contains approximate of 5 liter of blood. So we all know that males have a higher volume compared to your females. And it varies depending on the size of an individual. So actually class no more than 5% of the total blood volume can be taken. So remember that when you undergo bloodletting, so hindi masyado marami yung blood na kinukuha sa'yo, it's because it will be, you will be susceptible to shock and some other conditions. And for this, it should be no more than 5% of the total blood volume. So now let's go to your blood. So when you put the blood sample in the centrifuge, it will start to separate the blood constituents into three components, just like what you see here in the right part. So, first part is your solid portion. This is composed of the formed cellular elements. So, it is located at the bottom and the middle of a centrifuge blood sample. So, 45% here is red blood cells or erythrocytes which is settled at the bottom of the tube, while the middle part is your buffy coat which composed of your leukocytes or white blood cells and platelets or your thrombocytes. So this is seen in the middle layer, and this is like separating your red blood cell to your plasma or serum. So the liquid portion here is the 55% composition of the blood, which is known as your plasma. So you are confused to what is plasma and what is serum. So when you say plasma, this is the liquid portion of the blood of anticoagulated blood. Kapag anticoagulated yung blood sample, it is called plasma because meron pa siya ditong mga clotting factors. Unlike sa serum, it is also the liquid portion of the blood removed from the body. So this is in vitro of the clotted blood. So as you can see here, sa serum, wala siyang clotting factors, pero sa ating plasma, meron siyang clotting factors. This is one of the distinguishing factors between the two terms. And now let's go to your centrifuge. Centrifuge is an instrument used to speed up the separation of blood components. Inside your centrifuge, a carrier holds the tube in an upright position and the carrier spins a circle once started. So a centrifuge works by rotating at rapid speeds, thereby separating substances using the power of centrifugal force. So the speed of the centrifuge is measured by RPM or revolutions per minute. So remember that when you centrifuge a sample, it must be balanced. So when you see balance here, the volume of the sample must be equal to the volume of another sample. For example, if you have only one sample there in there needs to be spinned, so you need a balancer. So the balancer, ito yung kumukuha tayo ng extra tube, then maglalagay lang tayo ng just like tap water until ma-match natin yung volume niya sa ating blood sample. Then, we are ready to spin it. So, remember that when you put a blood sample, dapat yung opposite part niya is doon mo ilalagay yung ating balancer. So, remember that blood components separates according to their weight. So now let's go to the cellular elements of your blood. So as you can see here, you have three elements of your blood, which is your WBC, your RBC, and your platelets. So first, let's go to the function of each cellular elements. The first one is WBC. So the WBC is responsible for the body's defense. So remember that WBCs are fighting against microorganisms and maintains the optimal health of our body. So sila ito yung ating gwardya ng ating katawan at they are fighting against different kinds of microbes na sumisira sa ating kalusugan. Next one is your RBC. So the RBC is the one responsible to the transport of your oxygen to the tissues. And also they are the one who carries your carbon dioxide out from the tissues and deliver it to your lungs para ma-exhale ni lungs at mailabas itong carbon dioxide. And also, i-add ko dito ang isang function ng ating RBC is also to transport the nutrients from our food or from our intake. And they are also the one remove all the toxic metabolites from the cells. And it will be delivered into your kidneys para eliminate through the process of your excretion or your urination. Next one is the platelets. So platelets function is to stop the bleeding. So they are the one who is responsible or assigned in the coagulation process of our body. So now let's go to the formation of your cellular elements. As you can see here, three of them are formed in our bone marrow, except your WBC that is formed in two tissues, or two sites rather. The first one is bone marrow, and the second one is your lymphatic tissue. So here is the explanation, class. So the lymph nodes and other lymphatic structures like the spleen and thymus hold special white blood cells called lymphocytes. So usually, mga lymphocytes natin are hold in this particular lymphatic tissues. Kaya that's why you have two sites for production or formation in your WBC. Now let's go to the size and shape. So if you see the size, the WBC size is 9 to 16 micrometer. Ibig sabihin, malaki siyang cell compared to your two other cellular elements. So it varies from different size, shape, color, and your nucleus. So you will know later on what are these different types of your WBCs and what are their distinguishing characteristics. Let's go to your blood. So the size of your blood, this is 6 to 7 micrometer. So it's quite smaller compared to your white blood cells. And this shape is like a biconcave disc. So, para siyang biconcave disc, kung sinasabi nga nila, this is more like a donut shape but wala siyang hole or wala siyang butas sa gitna. And this is an enucleated in mature form. Kaya siya naging biconcave disc kasi wala siyang nucleus. And this is a form of a mature red blood cell. Next one is your platelets. So this is the smallest and only size as 1 to 4 micrometers. And this is a fragment or the shredding of your megakaryocyte. So this is your platelet. So the lifespan of each cell elements for your WBC, it varies. So usually it takes only until 24 hours and some it will take until years. And also for your RBCs, actually your RBCs only last until 100 to 120 days. While your platelet only lasts for 9 to 12 days. Please remember the lifespan of each cellular elements. So the reference values of each cellular elements for your WBC, that is 3.5 to 11 times 10 to the 9th per liter. While your RBC, that is your 3.8 to 5.9 times 10 to the 12th per liter. While in your platelet, that is your 150 to 450 times 10 to the 9th per liter. So now class, let's go to your topic, which is hematopoiesis. the formation, production, and the development of your blood cells. Actually, this topic is seen in your hematology, but I will just only dictate or state an overview of this lesson. So, all blood cells rises from your multipotential hematopoietic stem cells. So, or your hemocytoblast. So, from your hemocytoblast, it will give rise into two progenitor cells. You have your common myeloid progenitor and you have your common lymphoid progenitor. So, under common myeloid progenitor, it will give rise into either megakaryocyte, erythrocyte, mast cells, and myeloblast. So here in myeloblast, so it will develop and mature into four different WBCs. So the first one is your basophil, known for its dark blue or basophilic granules. Next is the neutrophil, known for its multi-segmented lobes. The next one is your eosinophils, known for its bright red granules. And the last one is monocyte, known for its kidney-shaped nucleus. So actually, your monocytes are the largest of among the four. So actually, your monocytes can be also differentiated into two kinds of cells. So you have your macrophage and your dendritic cells. So first one is the monocyte differentiate into dendritic cells under inflammatory conditions in peripheral tissues. And the other one is when the tissue is damaged or in infection, so the monocyte leaves the bloodstream and enters the affected tissue or organ, undergoing a series of change to become a macrophage. So on the other hand, also the megakaryocytes will start to shed or they start to shed, uh, causing the formation of your platelets or your thrombocytes. So now let's go to your common lymphoid progenitor. So your common lymphoid progenitor will give rise to your natural killer cells, known for its large granular lymphocytes and also your small lymphocytes. Our small lymphocytes will vary from the location they are maturing. So from your T lymphocytes, it is usually found in your thymus. So doon sila nag-mature sa thymus, while your B lymphocytes is in your bone marrow. So your B lymphocytes will be um, differentiated into plasma cells. So the mature B cells that moves into the periphery can be activated by antigen and become an antibody secreting plasma cells, which will respond more quickly to a second's exposure to your antigen. So class, that is only a brief overview of what hematopoiesis is all about. Okay, let's go to your cellular elements. The first one is your red blood cells, known as your erythrocytes. So the erythrocytes or red blood cells live about 120 days once they enter the bloodstream. So your red blood cells consist a membrane that encases your hemoglobin, which is known as the iron-containing pigment. So the function of your hemoglobin, it holds the oxygen molecules. So it also releases the oxygen to the tissues and brings carbon dioxide to the lungs. So remember that the person who is anemic has too little hemoglobin. That's why kung makikita mo yung person na anemic siya, medyo maputla siya because wala siyang itong tinatawag nating hemoglobin or lacking siya sa tinatawag nating hemoglobin, which contributes to the red pigment of your red blood cells. So many people with anemia also have decreased number of red blood cells. But on the other hand is the polycythemia, which the body has too much hemoglobin. So naging too much hemoglobin siya due to the increased production of your red cells. So in your polycythemia, the body makes too much red blood cells, causing the blood to be thicker than usual. And also that your red blood cells contains antigens on the surface that determines the blood type of a person. So, every person has this antigen kung ano talaga yung kanilang blood type, like your A antigen for type A blood, you have your B antigen for your type B blood, you have your type AB antigen, which is found in your AB blood, and no antigen, which is found in your O blood type. So now let's go to our second cellular component, which is your white blood cells. So other name for your white blood cells is known as leukocytes. So the leukocytes are the ones responsible for fending out or fighting out those harmful microorganisms and also the stimuli from the outside environment. So as part of your immune system, white blood cells circulate in your blood and responds to your injury or illness. So actually class that your white blood cells vary greatly in size. So it appears as large white cells with purple centers known as its nuclei when viewed in a stain smear. So as you can see here, every cell has its own variations of shapes and also sizes. So the first one is the largest WBC here is your monocyte. So if you compare the other one, so lymphocyte is quite smaller compared to your 4 WBCs. So some have granules that stain pink or purple, which is found in your neutrophils, and then blue, which is found in your basophil. So usually your basophil has this dark blue granules, and the other one has the orange or the bright red orange granules found in your eosinophils. So MedTech performs differential count that can help in the identification of disease. So this is a procedure in your hematology wherein you will count at least 100 WBCs and you will categorize them based on their distinctive characteristics. So any decrease or elevations of these white blood cells beyond their normal limits is considered as significant. So now let's go to your third cellular element known as your platelets. So other name for your platelets is your thrombocytes. So platelets are tiny blood cells that helps your body form clots to stop bleeding. So actually they are the smallest of the form elements because they only measured at least 1 to 4 micrometers, and they are the fragments or shedding of your megakaryocyte from the bone marrow. So usually your platelet has three essential functions, which is your platelet adhesion, your platelet secretion, and your platelet aggregation. So the process of spreading across the surface of a damaged vessel to stop bleeding is known as adhesion or platelet adhesion. So this is because when the platelets get into the site of injury, they grow a network or sticky tentacles to help them to stick or adhere to one another. So once they adhere to one another, they secrete chemical signals or substances to attract more platelets in the site. Usually, the additional platelets pile onto the clot in the process called aggregation. So platelets aid in clotting process by sticking together. So when they already stick together, they will start to enclose the damaged blood vessel. So now let's go to the two major blood vessels in your body. So you have your arteries and your veins. So let's describe their distinguishing characteristics based on their own definition. So artery, it carries blood from the heart, and it also carries oxygenated blood except your pulmonary artery. While in your veins, it carries blood to the heart and carries deoxygenated blood except your pulmonary vein. So here is the explanation bakit exempted the pulmonary artery and your pulmonary vein with their designated blood na dinadala. So for your pulmonary artery, the blood moves into the right ventricle. So then your blood is pumped into the pulmonary artery, and the pulmonary artery carries the deoxygenated blood into your lungs. So here, the blood will become oxygenated. While on your pulmonary artery, bakit siya exemption? Kasi galing sa lungs, the blood refill its oxygen supply and gets rid of your carbon dioxide. So the oxygenated blood returns from the lungs to the left atrium of the pulmonary veins to the heart. So the left ventricle then pumps this oxygen-rich blood throughout the body. So that's why pulmonary vein carries oxygenated blood from the lungs, while pulmonary artery carries the oxygenated blood to the lungs. So it is an opposite. So let's go to the color of your blood vessels. So the color of your artery, that is bright red, and your vein is dark red. So here is the explanation for that. So the blood going out to your body in the arteries is full of oxygen, which makes the blood bright red. But the blood coming back from your body in the veins is darker because your body parts have used up some oxygen in the blood. That's why veins looks purple or blue. So next is the walls of your blood vessels. So your artery, it has an elastic walls that expands with the surge of your blood. So also your arteries has these characteristics of being a thick-walled blood vessel. So the blood emerges from the heart under high pressure. So in this order to withstand this pressure, the arteries should have a thick and elastic walls. So your veins, it has less elastic and contains only 18 walls. So remember in your arteries, it has no valves. It has no compartments that pushes blood back and forth throughout the circulation because it has pressure. While your veins, it has valves. So it like compartments that when the blood flows, it turns to close, then opens once again, then close. So there is one condition that your vein has to this backflow because due to the defective valves in your blood vessels. So it is known as your varicose veins. That's why when you see people with varicose veins, they have enlarged veins since the blood does not move correctly. Rather, it returns back and forth through that area. That's why they have enlarged veins in their feet. Next is a pulse. When it comes to pulse, your artery has a pulse while your veins does not. So if you try to palpate your arteries, it tends to have a pulse. So if you check your ulnar and your radial arteries, nakikita mo parang may nagbibit. That is known as your pulse. So now let's go to the three layers of your blood vessels. So the first one is your tunica intima. So the tunica intima is the inner layer surrounds the blood as it flows through your body. So your tunica intima is lined with endothelium, areolar, and elastic tissues. So your tunica intima regulates your blood pressure, prevents the blood clots, and prevents toxins out of your blood. It also keeps your blood from flowing smoothly. Next one is your tunica media. So tunica media is the middle layer, consists of your elastic fibers that keeps your blood flowing in one direction. Actually, it is the middle layer of your circular smooth muscles. So the media also helps in vessels expand and contract. So tunica media is also responsible for the vasodilation and vasoconstriction of your blood vessels. Next one is your tunica adventitia, or also known as your tunica externa. So tunica adventitia is the outer layer, uh, contains nerves and your tiny vessels. So actually your tunica adventitia delivers oxygen and nutrients from your blood to your cells and also helps removing waste. It also gives the blood vessel their structure and support. And it consists primarily of your collagen and elastic fibers. So let's go to the type of blood vessels continuation. So here you can see here is veins. So the veins are three thin-walled vessels. Similar to your arteries, it has tunica intima, tunica media, and your tunica externa. So here, if you compare the image between the two, your artery is quite more thicker compared to your vein, which is slightly or more thinner compared to your arteries. However, the unique property of your vein, it has valves. So the valve is to prevent the backflow of the blood. So here, the blood will pass here. Then after the blood will pass, the valves will start to close. Then if the valve opens, the blood will start to move upward. So in varicose veins or in that varicose veins condition, the blood will start to open, move forward, but when the valves open, they tend to get back. That's why in people with varicose veins, they tend to have larger veins, especially in their feet, because there is an impaired movement when it comes to your valves. So class, let's go to your artery. So as you can see here in the image on the left side, your artery contains a bright red color blood vessel. So as you can see here, may tatlo siyang layer indicated. First one is your tunica intima or your inner layer. It consists of endothelium that lines all the lumens of all vessels. The second layer is your tunica media or middle layer. It consists of smooth muscle cells and elastic fibers. So the third one is your outer layer, which is composed of your collagen fibers. So your arteries usually have a strong thick walls. So these thick walls helps withstand the pressure of the pumping heart. So usually your arteries are constantly expanding and contracting depending on the situations. And also form branches called arterioles that branch even more to become capillaries. Then capillaries start forming together to create venules, then become veins. So actually the flow of blood also regulates the body temperature. When the body gets warm, the capillaries in the extremities dilate and let off heat to cool the body. So if the body becomes cold, the capillaries constrict so that less blood flows, thereby conserving heat. So remember that your blood vessels also involve in thermoregulation. Let's go to your veins. So veins, the majority of your veins are small or medium sized with less than 1 centimeter in diameter. So actually, the veins have valves, especially the numerous veins in the legs. So usually, the calf muscles and the muscles of the feet needs to contract with each other to squeeze the veins and push the blood upward. To keep the blood from flowing up and not back down, so usually these veins contains a one-way. Usually in our lower limbs, baka siya numerous because our lower limbs is longer. That's why they are having numerous valves there, and also they are opposing the flow of your gravity, which is the movement downwards. Kaya mas mahalaga na mas marami yung kanyang valves. And it consists of your pairs semilunar folds of tunica intima, which prevents the backflow of the blood. So here is example of your normal valve. As you can see, the valve closes every time accumulation ng blood. So nagko-close siya, preventing the blood from going down. So this is in a normal process. However, in a damaged valve, the blood moves forward, but once the valve closes, some blood or most of the blood returns back to this spot. So, ang nangyayari dito is nagkakaroon lang ng accumulation of blood. That's why you have enlarged veins. And usually, this happens in the lower extremities. Kung tinatawag nila, ito yung tinatawag nilang varicose veins. When you say varicose veins, it is a condition where you have a defective valve uh, in your lower extremities, and instead na yung blood is going upward, they are remaining in one part, resulting to an enlarged vein in that area. And also remember, class, that veins carries the blood towards the heart. So in any disposition man yan, if it is in the upper body, the movement is downward, but from the lower extremities, the movement of the blood to the heart is upward. Okay, the next one is your heart. So the heart is a muscular organ about the size of a fist, and it is located just behind and slightly left of the breastbone. So the heart pumps blood through the network of arteries and veins called the cardiovascular system. Usually, our heart is a muscle with four distinct chambers. You have your right atrium, right ventricle, left atrium, and your left ventricle. So, the right atrium receives blood from the veins and pumps it to the right ventricle. Next is the right ventricle receives blood from the right atrium and pumps it to the lungs where it is loaded with oxygen. Next is the left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle. And lastly, the left ventricle, or the strongest chamber, pumps oxygen-rich blood to the rest of the body. So the left ventricle's vigorous contractions create our blood pressure. Please remember that blood enters the heart through the right and left atrium, or the atria, and blood leaves the heart through your right and left ventricle, or also known as ventricles. So also here you have septum. The septum is a muscular wall that divides the right and the left sides of your heart. And actually, the weight of a normal adult heart from the females, it is 250 to 300 grams. It is mostly like 1/4 kilogram of something. And your males, it is 300 to 350 grams, which measures at least 1/3 of your 1 kilogram. Let's go to the structures of your heart. So as you can see here on the left side, this one is the position of transverse pericardial sinus. This part, this one is the heart, and this one is your fibrous pericardium. The inner part is your serous pericardium, which is consists of your parietal layer, and your visceral layer, which is known as the epicardium. Here, this is your pericardial activity in this part, and this one is the diaphragm, which is a part of your respiratory system. So let's discuss the parts of your heart one by one. So the first one is your pericardium. So pericardium is the sac that encloses the heart. So the function of your pericardium, it provides lubrication for the heart and shields the heart from infection and malignancy. So it contains the heart in the chest wall. The second one is your endocardium. So the endocardium is a membrane layer that lines the inner chambers of the heart and the valves. So it keeps the blood flowing through the heart separate from the myocardium or cardiac muscles. It also lines the valves, which opens and close to regulate blood flow through the chambers of the heart. Next one is your myocardium. It is the middle layer that is muscle of the heart itself, or the cardiac muscle. It is also the thickest layer of the heart. So the function of your myocardium is it contracts and releases involuntarily, which is responsible for keeping the heart pumping blood around the body. So next is your epicardium. So the epicardium is the outermost membrane that reduces friction. So actually, our epicardium serves many functions, including protecting the heart, producing factors that helps the cardiac cells properly develop, and ensuring a proper response to cardiac cell injury. The next one is your endocarditis. From the term itself, endocarditis, it is an infection in the endocardium. So if untreated, it will destroy the valves by eating away the part of the tissues. So remember that there are organisms that is usually promoting or causing endocarditis. So the next one is the occlusion, or when coronary arteries are blocked, it leads to myocardial infarction. So it is similar to your ischemia, in which a condition of a blood flow is restricted in the part of the body. So usually, when it happens, it causes the decrease in the oxygen supply in the delivery of nutrients, causing the tissues there to die, which is leading to what we call heart attack. So if it happens in the heart, it will cause a heart attack. So now let's go to our blood flow chart. So actually, the oxygenated blood enters the heart from the upper part of the body, which is your superior vena cava, as you can see here, and the lower part, which is from your inferior vena cava. So the first chamber that receives the oxygenated blood is your right atrium. So from right atrium, then it will move into right ventricle, but it will cross into your tricuspid valve. So the tricuspid valve is a one-way valve to prevent blood from flowing back. It regulates blood flow between the right atrium and your right ventricle. Then after, from the right ventricle, it will move into your pulmonary arteries to the lungs. So it will pass through your pulmonary valve. So your pulmonary valve controls the blood flow from the right ventricle into the pulmonary arteries, which carries blood from your lungs to pick up your oxygen. So remember that your pulmonary artery is the only artery that carries deoxygenated blood. So after the blood will be sent to the lungs, it will return to your pulmonary veins. So your pulmonary vein is a vein that carries oxygenated blood. So after from the pulmonary veins, it will pass to your right atrium, or left atrium rather. Left atrium, then it will transfer to your left ventricle. But before it will transfer, it will pass into your mitral valve or your bicuspid valve. So the mitral valve is a valve that lets the blood flow from one chamber of the heart, which is the left atrium, to the another chamber, which is your left ventricle. So after the blood has been transferred to the left ventricle, so it produces extreme pressure to be able to pump all parts of the body. Hence it has your thick wall. So from your left ventricle, it will pass to your aorta, but it will pass also to your aortic valve. So aortic valve opens when left ventricle squeezes to pump out your blood. And also it closes between heartbeats to keep blood from going backwards into the heart. So from your left ventricle, it will pass into your aorta. So after it will pass into your aorta, it will be transferred into your arteries. So from arteries, it will transfer to your arterioles. Then it will be transferred into your capillaries, then to your venules, and lastly, it will be passed into your vein. So after it will pass into the vein, it will back to your superior and inferior vena cava. So it will, depending if where the vein resides. Then the cycle continues. Now let's go to the example of test for your heart disease. The first one is your alanine aminotransferase, and the last one is your aspartate aminotransferase. So both of them are liver function tests, but usually aspartate aminotransferase is also effective in detecting cardiac problems. However, in some instances, your alanine aminotransferase is slightly elevated if there is a heart problem or heart disease. Next is your blood gases. So it is also important that you have a test for blood gases since metabolic alkalosis is the most common complication of congestive heart failure. Next is your BNP or your brain natriuretic peptide. It is a blood test that measures the level of protein called BMP that is made by your heart and blood vessels. So BMP levels are higher than normal if you have heart failure. Next also is CKMB or your creatine kinase MB, which is a test for acute myocardial infarction. Then you have your complete blood count. So complete blood count is also a helpful tool in detecting heart problems. And then you have your C-reactive protein. So there are studies that there are elevated C-reactive proteins associated with heart attack. Next is your lactate dehydrogenase or your LDH1, which is primarily found in your heart muscle and red blood cells. If it is elevated, then therefore there could be a sign of a heart disease. Next one is your myoglobin. This is a test also that protein that is elevated during acute myocardial infarction. And you have also your troponin I is the most common ordered test during emergencies because if you have an experience in the hospital, you will always see a request that there is a troponin I, meaning that the patient might have a possibility or might have a possible heart problem being admitted there, and it is a stat test. It means that it must be done as soon as possible. So now let's go to the veins and arteries of the circulatory system for the phlebotomist. So here you can see antecubital fossa. It is the region of the arm where usually the phlebotomist chooses to draw blood. So it is found in the bend of the arm. And also you have also sites like the back of the hand, wrist, ankle, or foot. So why is it that antecubital fossa is the choice? Because the veins are near the surface and they are large enough. So as a phlebotomist, you won't be able to have a missed extraction because the veins are quite larger, and you can actually find it more easier compared to the other parts or other veins in the body. So it frequently forms an M or H shape pattern, which is usually common based on my hospital practice. So there are patients talaga na meron talaga siyang M pattern of veins in the hand, and there are also patients that has H pattern in the hands. Next is arteries may also be used in obtaining samples, but it requires special training. Actually, class, as an experienced phlebotomist, I may be showing to you that I had already tried this arterial puncture, but in your cases as students, we don't allow you to do that because it needs a thorough training or a special training from those medtechs that are already specialized in extracting blood in the arteries. So the first vein is your median cubital vein. So it is the center of your antecubital fossa because it lies between your cephalic and your basilic vein. So it is used majority of the time, and also it is the easiest to palpate and less tendency to roll because among the three veins, it is the more stable. Kahit galawin mo pa yung arm, the median vein will not move. Its stability makes it the most accessible vein of all the three. It forms a bridge pathway between your cephalic and your basilic veins. Now let's go to your cephalic vein. It is the second choice of vein if median cubital vein is not available. So it follows along the thumb side of the arm. So this is where your cephalic vein located. It is not prone to rolling, but sometimes it just rolls, but slightly more difficult to feel because although it is, you can see that there is vein, but when you palpate, I think there will be no bulging happening. But the advantage of your cephalic vein is that it is way more larger compared to your basilic vein. So the last vein is your basilic vein or the third choice, which is more difficult to feel because sometimes akala mo na vein pala yung napalpate mo but it's not because it could be another thing like tendons and it has a tendency to roll. So if it rolls, you will miss your extraction. But underlying this vein is the brachial artery and the median cutaneous nerve. It is the most critical part among the three veins because you may miss the vein but you hit sometimes the artery. So malalaman mo siya in the color of the blood released in the syringe. So actually, doing the venipuncture in these areas should be approached with caution. So without careful performance, it can cause a serious damage to the patient. Kaya when you utilize these two sites, please remember to take caution and also think if you can do it so that you will be able to assess yourself that you can extract the right amount of blood in that particular area. So this one is your veins in the hand. So here, this is your dorsal veins. And this one is your palmar veins. Actually, the palmar vein is not usually pinaperform natin the extraction because it's too painful to the patient. Rather, we prefer to have an extraction here at our dorsal vein because it is way more accessible. Plus, this is the usual site kung saan usually yung patient tinatakdan ng ating swero or ang ating dextrose. So usually, pinaperform na site dito sa ating dorsal veins is your um, dorsal venous arch. So pwede tayong kumuha dito ng dugo or rather this part. Mga parts na which is there are veins that can be bulging and also quietly bigger. So sometimes when we do venipuncture in this area, we use this needle smaller with a smaller gauge. So usually mga 23 gauge or you can also use butterfly infusion sets this area. But if you can get using a 23 gauge syringe, then it is possible. So class, this is one area also for your extraction, which is your arterial sites, usual arterial sites for blood extraction. So the first one is your brachial artery, which is located in your arm. So usually this is below sometimes of your basilic vein. That's why this is the reason why basilic vein is critical because you may not hit the vein but rather you may hit the artery below. So actually, in this part, you can obtain also hair blood, but it needs special training. So next is you have your radial and ulnar arteries. So in radial and ulnar arteries, this is done by the extraction in your wrist. So puncturing these blood vessels requires special techniques. So usually, ang mga nagpa-perform dito sa ating radial and ulnar arteries are yung ating mga respiratory therapist who took blood from this site and send it for arterial blood gas analysis. So this site is for blood gas analysis. But usually, if you want to get blood here at this area, you need to have a thorough training, at least an expertise when it comes to arterial puncture. So now let's go to the veins of the feet. It is the alternative when patients or veins in the arms are not available. So, but it needs permission from the physician because you cannot take blood here, especially when the patient is hyperglycemic or diabetic, because it could cause complications to the patient. and prone to clot formation that may cause blockage in other body parts. So, actually, these are the veins usually found in the feet, but based on my experience, the most easiest and the most accessible vein if you want to get in the feet is your great saphenous vein because it is quite larger compared to the other veins. And plus, it is usually the site, based on my experience, na kumukuha ko ng dugo, especially sa mga hemodialysis patients. Usually kasi yung mga kamay nila and arms are not available. And I always ask the nurse and always ask the physician regarding this kung it is diabetic. If it is non-diabetic, then you can get your blood sample at this area. Hello class, this is the last part of our lecture and I hope you enjoyed well with our topic. If you have any questions, please refer to your respective professors. Thank you so much and have a good day.